16-year-old mother arrested for allegedly taking her 5-year-old to a tanning bed has everyone shocked at not only what she's accused of, but also how ravaged her skin looks. We talked about this week. So we asked dermatologist Dr. Doris Day to tell us how much damage this can really cause. So welcome, doctor. Is there such a thing as a tanorexic? And
yes.
How much, and is her damage reversible?
Tanorexia is a term that we came up with really as dermatologists. It's something that we've observed in many of our patients who seem to be addicted to the ultraviolet radiation and even the color from a tanning salon. So we know that ultraviolet radiation is damaging to the skin. It's a type 1 carcinogen, which puts it in the same category as smoking. Right. So it's that bad for your skin.
But is the tanning booth worse than lying on the beach in the sun?
It can be. Yeah. Some of those bulbs can be hotter and more intense. They're the same wavelengths of light in slightly different dosages. And before, we didn't know as much about UVA, so they could say, oh, UVA rays were safe. But the World Health Organization came out and said that all wavelengths of ultraviolet radiation are damaging to the skin. Anyone exposed to enough of it will ultimately develop skin cancer.
We see a lot of men who like to look tan, like George Hamilton.
Yeah.
Is that a bad thing?
It's just not a good thing for your skin.
Especially with the repeat. I mean, the workers at the tanning salon reportedly said she had a $99 monthly pass and comes up to 20 times a month. Now, we can't confirm that ourselves, but how dangerous is that? And like a bartender who would be responsible for saying, I'm not going to overserve you, is that tanning salon responsible for saying, I'm not going to allow you to be overly tan?
Okay, well, let's put it into context. There's 3,000 visits to emergency rooms every year from burns from tanning booths. So this is a real problem. Over 1 million people go to tanning salons every day. 70% of those are young girls and women, 16 to 29 years old, and most of those are taken for the first time by their moms.
Is it reversible?
It is to some extent. So that is a great question, and the good news is that your skin is always turning over, always rejuvenating, so you can make new skin. But it's also cumulative damage. So every exposure you get, when you go 20 times a month, that's 20 times a month that you're damaging the DNA. It has to repair, and if you do anything over and over and over again, ultimately you're going to make mistakes, right?
Well, it also makes you look
up.
old. I think girls should know that if you get older and you've been tanning a lot, you are going to have a bad case of wrinkles.
That's the ultimate fear factor there.
Look like
I got to ask you too, because
causes wrinkles too.
Ultimately, what brought this to the forefront was a little girl, right? So I want to talk about that. She said that her 5-year-old daughter Anna did not go into the booth, the actual tanning booth with her, but was in the same room with her.
Yeah.
Do you perceive that as something to be dangerous for the child?
Well, the way that they're covered. So chances are she really didn't get much exposure. And you look at the mom with her children, I kind of feel bad for her in that way, because she looks like a great mom. Yeah, she looks like a loving, wonderful mother.
Do you think she needs more therapy than like prosecuting in jail?
Yeah, absolutely. And you know, that's the unfortunate part, is that she's now, you know, on the cover of the newspaper and she's getting a bad rap.
You should never put your kid in that tanning.
No, you should never put the kid in the tanning salon.
Most salons don't let you do. They don't let you put little kids in there. They're very strict on that.
We should be stricter, unfortunately. We're working on that. We are working on that.
I'm sorry, babe. I just want to ask you, because people still want to tan. They still. So is you doing a self-tanner better, the spray-on?
Yes,
it
absolutely.
is.
Yes. That's the only way to get a healthier tan or a safer tan. If you want that color, those sunless tanners.
Born that way.
But why does she like that?
You know, I'll try again.
Why does she want that color? She looks like a creamsicle,
like an anorexia or a bulimia.
She looks hideous.
That's the point. That's why
she doesn't see it in herself.
It's like the anorexic who says, I'm so fat.
She doesn't see.
She thinks she looks good?
She thinks she looks good, and if she looks lighter, to her, she looks pale and sickly. But to the rest of
bringing us this information, Dr. Doris Day. We appreciate your coming on with us whenever you do. And we have more. We'll be right back.